Healthcare in America. There are so many healthcare workers who are from the Caribbean, and many people are doing their thing. But when's the last time you checked on Granny? When's the last time you checked on your mother or your dad? Or your auntie? Make sure they have insurance. And make sure their health insurance is covering the services they need. Why? Because I had a conversation just last week with a healthcare provider, and they said there's some insurance companies that are not covering the cost of service. I'm like, that makes no sense. Why would they wait until after annual enrollment period that ends December, and then wait until the following year, which we're in 2025, to help you follow the timeline here. They wait till things are in effect, that people are paying their premiums, to then say, oh, by the way, here's a list of providers we're no longer paying your coverage for. So make sure to book those appointments and get the service done before the end of the month, because after that, we're not paying it. So you're telling me you wait until the middle of April to tell these people that you're not going to cover the healthcare services by the end of May is like the cutoff date? Most of these people don't read their mail. They're not reading any email alert. And if their provider doesn't tell them or get the notice to them soon, they're not going to know. And most times when providers are calling your granny's phone or your parents' phone if they're older, it might show up as scam likely. It might not show up as a provider's name. And because they're weary of scammers, even if their name showed up, sometimes they're going to be like, what is this, a scam? This makes no sense. I really signed up with my healthcare provider to cover me for 2025. Are you telling me they're not going to cover? And here's a little insider information I found out. Some of these providers are choosing not to cover services. Let's say, for example, there are 60 healthcare providers for a specialized service in a region. They'll say, okay, out of that 60, we're going to cancel contracts with 50 of them and leave it just as 10. And the 10 are spaced out so far out. So now that person who lived 20 minutes away from their health care provider who is accepting that insurance